If you find the information presented here helpful, please like, subscribe, and comment to help share this to a wider audience who may also need the information. We will talk about the difference between type 1 and type 2 diabetes. Diabetes is a chronic health condition that affects how your body turns food into energy. There are two main types of diabetes, type 1 and type 2. Type 1 and type 2 diabetes are two distinct forms of diabetes with different causes, characteristics, and treatments. Here are the key differences between them. Type 1 diabetes. Autoimmune disorder. Type 1. Diabetes is an autoimmune disorder. The immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. As a result, little to no insulin is produced. Onset. It often begins in childhood or adolescence, but can develop at any age. It accounts for about 5 to 10% of all diabetes cases. Insulin dependency. People with type 1 diabetes require daily insulin injections or the use of an insulin pump to survive. Insulin therapy is necessary because the body cannot produce its own insulin. Causes. The exact cause is not known, but genetics and environmental factors, such as viral infections, may contribute to its development. Symptoms. Symptoms can develop rapidly and include extreme thirst, frequent urination, unexplained weight loss, fatigue, and blurred vision. Type 2 diabetes. Insulin resistance. Type 2 diabetes is characterized by insulin resistance, where the body's cells don't respond effectively to insulin. Initially, the pancreas produces extra insulin to compensate, but over time, it can't keep up. Onset. It typically develops in adulthood, although it is increasingly being diagnosed in children and adolescents. It accounts for the majority of diabetes cases, around 90–95%. Treatment. Initially, it may be managed through lifestyle changes like diet and exercise. Some people with type 2 diabetes may require oral medications, insulin, or other injectable medications to control blood sugar levels. Causes. The primary risk factors include genetics, obesity, physical inactivity, and poor diet. Lifestyle factors play a significant role in its development. Symptoms. Symptoms may be subtle and develop gradually. They include increased thirst, frequent urination, fatigue, blurred vision, slow wound healing, and recurring infections. Management. Lifestyle modifications, including a healthy diet, regular exercise, and weight management, are key components of managing type 2 diabetes. Medications or insulin therapy may be prescribed if blood sugar levels cannot be adequately controlled through lifestyle changes alone. Both types of diabetes can lead to serious complications if not properly managed. Regular monitoring of blood sugar levels, a balanced diet, exercise, and medication as prescribed by a healthcare provider are essential for managing both type 1 and type 2 diabetes. If you find the information presented here helpful, please like, subscribe, and comment to help share this to a wider audience who may also need the information. 10 common signs and symptoms that may indicate you could be diabetic. Frequent urination. If you find yourself needing to urinate more often, especially at night, nocturia, it could be a sign of diabetes. This happens because your kidneys are working overtime to filter and absorb excess sugar in the blood. Increased thirst. Excessive thirst, even after drinking fluids, is a common symptom. This is linked to the increased urination and your body's attempt to replace lost fluids. Unexplained weight loss. Despite eating more than usual, you may lose weight without trying. This occurs because your body can't effectively convert sugar into energy, so it starts burning fat and muscle for energy. Increased hunger. You might feel hungry more often, even after eating a regular meal. This is because your body's cells aren't getting enough glucose for energy. Fatigue. Diabetes can lead to a general feeling of tiredness and lack of energy. Without enough glucose in your cells, you may feel exhausted. Blurred vision. High levels of blood sugar can cause the lenses in your eyes to swell, leading to blurry vision. This usually resolves once blood sugar is controlled. Slow wound healing. Diabetes can affect your body's ability to heal and repair itself. Cuts and bruises may take longer to heal. Tingling or numbness. High blood sugar can damage nerves, causing a tingling or numb sensation, often starting in the feet and legs. Recurrent infections. Diabetes can weaken your immune system, making you more susceptible to infections, especially skin, gum, or urinary tract infections. Darkened skin patches. Acanthosis. Nigricans is a condition where patches of skin, often around the neck or armpits, become darker and thicker. It can be a sign of insulin resistance. If you are experiencing any of these symptoms, it is important to see your doctor for a diagnosis. Diabetes is a serious condition, but it can be managed with diet, exercise, and medication.
Foods that help prevent or control diabetes and lower blood sugar. A healthy diet is essential for preventing or managing diabetes. The right food with the right nutrients and properties will help prevent diabetes or manage your blood sugar level if you're diabetic. Here's a list of nutritional properties you should look for in the food you consume and a list of recommended foods. Low in carbohydrates. Carbohydrates are broken down into sugar in the bloodstream, so it is important for diabetics to choose foods that are low in carbohydrates. High in fiber. Fiber helps to slow down the absorption of sugar into the bloodstream. Low on the glycemic index. The glycemic index is a measure of how quickly a food raises blood sugar levels. Foods that are low on the glycemic index are better for diabetics because they do not cause a rapid spike in blood sugar levels. Good sources of protein. Protein helps to keep you feeling full and satisfied, which can help to prevent you from overeating. Good sources of healthy fats. Healthy fats can help to lower cholesterol levels and improve blood sugar control. Packed with nutrients. Many of these foods are good sources of vitamins, minerals, and antioxidants, which are important for overall health. Here are 17 of the best foods to help prevent diabetes or help lower your blood sugar level. Beans are a good source of protein, fiber, and complex carbohydrates. They are also low on the glycemic index, which means they do not cause a rapid spike in blood sugar levels. Non-starchy vegetables are low in calories and carbohydrates, and they are high in fiber and other nutrients. Some examples of non-starchy vegetables include broccoli, cauliflower, carrots, celery, cucumbers, leafy greens, peppers, and tomatoes. A study published in the journal Nutrition Reviews found that eating non-starchy vegetables can help to lower blood sugar levels and improve insulin sensitivity in people with type 2 diabetes. Whole grains. Whole grains are a good source of fiber, vitamins, and minerals. They are also low on the glycemic index. Some examples of whole grains include brown rice, quinoa, oatmeal, and whole wheat bread. Lean protein helps to keep you feeling full and satisfied. It also helps to regulate blood sugar levels. Some examples of lean protein include fish, chicken, turkey, tofu, and beans. Nuts and seeds are a good source of healthy fats, fiber, and vitamins. They can help to lower cholesterol levels and improve blood sugar control. Fruits are a good source of vitamins, minerals, and fiber. They are also low on the glycemic index. However, it is important to choose fruits that are lower in sugar, such as berries, apples, and pears. Olive oil is a healthy fat that can help to lower cholesterol levels and improve blood sugar control. It is also a good source of antioxidants. Yogurt is a good source of protein, calcium, and probiotics. Probiotics are live bacteria that are good for the gut. Yogurt can help to improve digestion and regulate blood sugar levels. Water is essential for good health. It helps to flush out toxins and keep the body hydrated. It is also important to drink water when you are taking diabetes medications, as these medications can cause dehydration. Herbs and spices can add flavor to food without adding calories or carbohydrates. Some herbs and spices that are good for diabetics include cinnamon, ginger, turmeric, and garlic. Foods like spinach, kale, and collard greens are low in carbohydrates and calories while being rich in vitamins, minerals, and fiber. Salmon, mackerel, sardines, and other fatty fish are excellent sources of omega-3 fatty acids, which are heart healthy and may help improve insulin sensitivity. Blueberries, strawberries, and raspberries are low in sugar and high in fiber and antioxidants. They can satisfy your sweet tooth without causing rapid blood sugar spikes. Sweet potatoes. These provide carbohydrates but have a lower glycemic index compared to regular potatoes. They're a good source of fiber, vitamins, and minerals. Tomatoes are rich in lycopene, an antioxidant that may help reduce the risk of heart disease and improve blood sugar control. While not a food on its own, cinnamon is a spice that may help improve insulin sensitivity. Adding it to foods can enhance flavor without adding sugar. It's advisable for individuals with diabetes to work with a healthcare professional or registered dietitian to create a personalized meal plan that meets their specific needs and helps maintain stable blood sugar levels.